Hello everyone, welcome to Pharma Icon, and the today's topic is classification of drugs in pharmacology. Okay, and what are the drugs today we are going to discuss are drugs for bronchial asthma. First of all, what is bronchial asthma? Bronchial asthma is also called as an asthma, okay, which is a chronic condition in which chronic means the patient is need to take under medical management for the long time, okay, and there is no proper treatment for the prevention of asthma, okay. And asthma is affect mostly 25 million people in USA, and currently 5 million children they are suffering with the asthma, and asthma is between 30 days to 2 years. The long period of asthma is 30 days to 2 years based on the patient's immune system response, okay. This is about the bronchial asthma. So coming to the classification of drugs under the treatment and prevention of the asthma, bronchial asthma, and the first one are corticosteroids. What are corticosteroids? The corticosteroids are nothing but these are the type of drugs, okay, in which they are mostly used for the treatment and prevention of anti-inflammatory situations, okay. And these corticosteroids are act as an medicine for anti-inflammatory, okay. They are used to treat mostly the inflammatory conditions like asthma and allergic conditions, bowel diseases and Addison's diseases, and organ rejection, hormone replacement therapy. So these are the situations where we use the corticosteroids, okay. First of all, how this asthma can be treated, and asthma can be treated. For this asthma there is no cure, but many treatment are helps to prevent and control the symptoms of long term asthma, okay. What are the easy medications like by using of inhalers, following the medications like bronchodilators and steroids, using of some breathing techniques, and acupuncture. In acupuncture there will be a trained person and well expert person in acupuncture, and steam therapy is used along with the biologics, and quick relief medication can also be used for the treatment in the asthma, okay. So this is about the how asthma can be treated. And what are corticosteroids? We know that corticosteroids are mostly used for the anti-inflammatory medications. Drugs coming under the class of corticosteroids are systemic corticosteroids and inhalational corticosteroids. What are systemic corticosteroids? Systemic corticosteroids are the type of corticosteroids which is mostly taken by the mouth or sometimes given as a intramuscular injection, okay. These are called as a systemic corticosteroids, okay. These systemic corticosteroids are act as a synthetic steroid derivatives, okay. These are synthetic, they are not naturally, but these are synthetic derivatives. They are shows the anti-inflammatory effect, means they reduce the process of inflammation. So what are the drugs under the class of systemic corticosteroids? These are hydrocortisone, prednisolone, and other glucocorticoids. These are the drugs coming under the systemic corticosteroids. And the next category under the corticosteroids are the inhalational corticosteroids. What are inhalational corticosteroids? Inhalational corticosteroids are also one of the anti-inflammatory medication which is mostly used to treat the asthma or other obstructive airway diseases, okay. And how these inhalational corticosteroids can treat asthma? These are mostly similar to the cortisone and works by stopping the cells in the lungs which are producing the substances for causing the asthma, okay. These inhalational corticosteroids are stops the substances which are released in the lungs, that substances to be affected the asthma, okay. That substances are stopped by the inhalational corticosteroids. What are the drugs coming under the inhalational corticosteroids are mostly biclomethasone, dipropionate, budesonide, fluticasone, propionate, flunazolide and cisolonide. These are the drugs coming under the inhalational corticosteroids. Okay, and the next category of the drugs are bronchial asthma. How to treat the bronchial asthma? The bronchial asthma is a type of asthma. And what is the reason for bronchial asthma? It is an atopic disease. That is means a genetic predisposition towards the production of IgE antibodies in response to the pollen, house dust and mites, fungi and animal proteins. These are the various causes or reasons for the bronchial asthma. What are the drugs are under the bronchial asthma? They are leukotriene antagonists. Okay. First of all, what are leukotriene antagonists? Leukotriene antagonists are the class of drugs. These are mostly used to treat bronchial asthma and allergic rhinitis. And how they work? The leukotriene antagonists are mostly blocking the effect of leukotrienes or preventing the body from producing the leukotrienes. Okay, and next in the body from producing them. And how these works? These are works by combination of the antibodies and the bronchodilators. Okay, how this leukotriene antagonist can be given? The combination of drugs by anti-inflammatories and bronchodilators. Okay, these are mostly inhibit the cysteine leukotrienes. Okay, these are the drugs inhibits the cysteine leukotrienes. And how they are used? They are mostly leukotriene antagonists are taken as a tablet in once or twice daily. Okay, that is known as a monotherapy. And what are the side effects of leukotriene antagonist? The leukotriene antagonist mostly causes the abdominal pain, headache and sometimes thirst feeling. Okay, and what are the potential risks associated with the leukotriene antagonist? They are neuropsychiatric events such as agitation, aggression and hallucinations. These are the conditions affect when they are potential risk of leukotriene antagonist. And what are the drugs coming under the leukotriene antagonists are mostly montelukast and gefrileucast. Leu means associated with the leukotrienes. Okay, these are the two drugs important for treatment of bronchial asthma under the class of leukotriene antagonist. Okay, next category of drugs are mast cell stabilizers. Okay, first, what are mast cell stabilizers? Mast cell stabilizer are a type of medication in which they are mostly prevents the mast cells from releasing of inflammatory medication. What is the function of mast cell? The most activity of mast cell is to release the inflammatory mediators to treat the process of inflammation. What are the inflammatory mediators? Such as histamine, leukotriene, prostaglandin and cytokinins. These are known as inflammatory mediators. Okay, and what are mast cell stabilizers? They are mostly, these are used to prevent allergic disorders. And what are the allergic disorders? The allergic disorders like allergic conjunctivitis and allergic rhinitis. These two conditions can be prevented by mast cell stabilizers. Okay, and what are the drugs under the mast cell stabilizers? They are mostly sodium chromoglycate and ketotifen. These are the drugs under mast cell stabilizers. Okay, and the next category of drugs are bronchodilators. And what are the drugs coming under the bronchodilators? They are anticholinergics and beta-2 sympathomimetics. First, what is anticholinergics? And anticholinergics are the class of drugs that are mostly blocks the acetylcholine. Cholinergics. Okay, anticholinergics. Anti means opposite, blocking the action of the choline, and these are the receptors are the cholinergic receptors, blocks the cholinergic receptors. Okay, and what is the action of anticholinergics? These reduce the activity of certain parts of neurons nervous system, and these anticholinergics are mostly used to treat a variety of conditions like stomach, intestine and bladder spasms. Means They are mostly relieves the cramps or spasms in that areas, where the areas like stomach, intestine and bladder. And these are also used for treatment of nausea, vomiting and motion sickness, along with the Parkinson's disease and chronic obstructive pulmonary disease and asthma, along with hyperhidrosis, and used in the treatment of poisoning along with the surgery. And how these anticholinergics works in asthma? The anticholinergics are mostly used in asthma by blocking the effect of acetylcholine, okay, on airways or smooth muscles and the nerves, which prevents the airway obstruction. Okay, what are the drugs which prevents the obstruction in the airways? Those substances can be blocked by the effect of acetylcholine. Okay, and they also compete with the acetylcholine for receptor site at the nerve muscular junction. Okay, these are active at the nerve muscular junction and vagus nerve. Okay, and by this prevent the transmission of reflexes which are triggered for causing of the asthma stimuli. Okay, this is the mechanism under using of anticholinergics. And what are the drugs under anticholinergics? They are ipratropium bromide and tiotropium bromide. These are the two categories of bromides used in the anticholinergics drugs. Okay, and next, what are beta 2 sympathomimetics? Beta 2 sympathomimetics are the class of drugs are under beta 2 adrenergic receptors. Okay, adrenergic receptor agonist means they increase the action of the activity of the drug. Okay, a class of drugs that mimics the action of the epinephrine or norepinephrine. Adrenergic means we are using of the epinephrine and non-epinephrine. These are also called as a noradrenaline or adrenaline. Okay, they are used to treat the respiratory conditions. What are the respiratory conditions like asthma and COPD? What is the meaning of COPD? Chronic obstructive pulmonary disease. Okay, and what are the side effects of beta 2 sympathomimetics? The side effects under the beta 2 sympathomimetics are mostly arrhythmia, palpitations, myocardial ischemia, and increase the blood glucose levels, along with vessels damage in the kidney and blood, along with the bone demineralization. These are the side effects associated with the medication under beta 2 sympathomimetics. Okay, what are the drugs classified under beta 2 sympathomimetics are the salbutamol, terbutaline, bambuterol, salmeterol, formoterol. These are the drugs under beta 2 sympathomimetics. Okay, and the next classification of drugs under bronchial asthma, these are methylxanthines. Okay, what are methylxanthines? Methylxanthines are mostly relatively weak bronchodilators. Okay, methylxanthines are weak bronchodilators means less action in the bronchodilators. These are administered systematically. Okay, what is the mechanism action of methylxanthine? The mechanism action of methylxanthine is associated with the adenosine receptor antagonism, phosphodiesterase inhibition and calcium mobilization, along with chemoreceptor responsiveness and central nervous system excitation and respiratory muscle performance. These are the mechanism of actions are related with the using of methylxanthine. What are the drugs coming under the methylxanthine category? They are theophylline, aminophylline, choline and theophylinate, hydroxyethyl, theophylline and doxyphylline. These are the drugs under the methylxanthine. Okay, and the last category of drugs under the bronchodilators, the classification of drugs for bronchial asthma, these are anti-IgE antibodies. What are anti-IgE antibodies? The anti-IgE antibodies are nothing but the type of treatment for allergic diseases. Okay, these are bind to the immunoglobulin molecules for the prevention of allergic reactions. Okay, IgE nothing but which is mostly used to treat and prevention of the allergic conditions in the body. Okay, and how these anti-IgE antibodies works? The anti-IgE antibodies, these are bind to the free IgE and free IgE cells upon the beta cells, which prevents the allergic cascade for strengthening. Okay, this is about the anti-IgE antibodies, and these they reduce the amount of anti-IgE antibody in the body, and IgE is mediated symptoms. Okay, these reduce the IgE mediated symptoms. The drugs under the anti-IgE antibodies are omalizumab. This is a one type of drug used under the anti-IgE antibody. Okay, that's all for this session. This is about the complete classification of drugs under the asthma treatment. Okay, thank you, and do subscribe Pharma Icon.